Okay, so we're live on YouTube now. I'm going to go ahead and start the webinar session to allow people to come in and share my screen again so everybody can see the slides, and we'll get started.
So I'll wait for you, Erica, to put something in the chat to launch.
Sure thing. I'll do that. Hear me.
All right, good afternoon, everyone. Welcome to the Group Insurance Commission GIC Public Information Session for the benefit plan year July 1st, 2021 through June 30, 2022. My name is Matt Vino. I'm the Executive Director of the Group Insurance Commission. We are grateful for your attendance here this afternoon. This is the second of our 4 sessions, public information sessions that we will hold this week. As many of you will know, these are sessions that the GIC holds each year as part of our process to finalize plan design and to finalize premium rates for health insurance plans that will be offered during the coming annual enrollment, which begins in April. We typically hold these sessions in person across the state, but due to the governor's emergency measures to keep people healthy and safe during COVID-19, we are holding these sessions virtually by Zoom. Also, we are live streaming this session on YouTube and will post it subsequently, as we will with all of our sessions, onto YouTube. We're crossing our fingers that we don't have any global internet outages as we had yesterday, but we will keep our fingers crossed there. So our plan this evening is to do a brief presentation, about 30 minutes, followed by a question and answer period. I will be joined throughout the presentation by my colleague Denise Donnelly, a key member of my leadership team who helps lead our work around health benefits. We also have just a few, several members of the senior team at the GIC who will help assist in our responses to inquiries during the question and answer period. I have 2 housekeeping items just to start off with. First is to note, as it says at the bottom of this agenda slide, that your participation in this public information session, all of these sessions, is not required for you to participate in the coming annual enrollment. Just want that to be perfectly clear. This is completely voluntary and informational only. We do have, as part of this session, an interpreter for American Sign Language. So thank you for that. And we'll be providing this also by closed caption. A few more housekeeping items that we'll get to in a moment, but I do want to just briefly review the agenda for this afternoon. We'll start with a brief overview of the Group Insurance Commission. We won't spend a lot of time on that since many of you are likely very familiar with how we operate, but I also want to take the opportunity to highlight some of the challenges that we face in providing you affordable quality benefits. We will also provide you some information about our insurance premium rate development, which is for coverage starting on July 1st. We are in the process of developing those premium rates now, which will be finalized in March by our commission. We will also touch on plan design changes. You will note, as it says here on the slide, I'll give you sort of the punchline for that part of the presentation, which is that the GIC is not planning any plan design changes that increase cost sharing for members. So no increases in copays or deductibles for the coming year. And we are also not making any changes to the GIC retiree plan. We will talk about each of those in a little more detail. And then we'll be looking a little further down the road beyond this coming year and describe how we're preparing for the next big set of decisions regarding your health benefits that will be for coverage starting on July 1st, 2023. So several years down the road, but we are already very busy working on that. We will then, as I noted, have an opportunity for question and answer at the end. Next slide. There you go. So tonight, this afternoon, we are specifically seeking input on premium rates and insurance plan design, as I mentioned, as well as on our coming engagement strategy that will be leading up to the changes that we'll be looking to make in calendar year 2023. Our initial plan for these sessions was to provide an opportunity for verbal testimony, but for this and many other sessions, the response to these has been overwhelming. In fact, for this session, we have nearly 2,000 people registered. So it just makes that not particularly practicable. So we've had to change the format a little bit. So at any time during the presentation, you may use the Q&A tab at the function of the Zoom, which is on the toolbar, to submit any questions for us to consider. We will be prepared to take those up, those that we get today and those that we have received by email in advance of this session. As of course you can appreciate, with that many participants here, we may not get to every question, but we will commit to do a few things after we complete our 4 listening sessions this week. Number one, we will compile and post an FAQ, frequently asked questions document, responding to the questions that we receive. We will be compiling as well a comprehensive report on the listening sessions that we will be providing to our commission, in addition to a summary of those sessions for our commission. So all of that material we will make available to you and to the public on the GIC website. I also want to note that for those of you who wish to make a longer statement, not necessarily a question that is intended for response this evening, I would encourage you to use our information email, which is posted here on this slide, gic.info@mass.gov. We will review all of those materials that are submitted. And again, all of this material will be posted on our website. Also, finally, if you have questions that are specific to your coverage, and that may, in fact, include kind of personal health information about you or a unique circumstance around your coverage, I would strongly encourage you to submit those questions to us directly at the link that you'll see at the bottom of the slide here, or to call us directly. We're happy to put you in touch with the appropriate members of our operations team who can work through any specific issues that you may have. Next slide, please. And next slide. So first we'll start off through a little bit of kind of general information about the GIC. And of course, we'll always start with our mission. It's a pretty simple and straightforward mission. And I would just note 2 elements of the GIC mission. One is the word right at the top, middle of the top sentence here, and it's our members. And you are always, as you always should be, at the heart of all the work that we do here at the GIC. I'm one who holds a belief, a little bit old-fashioned these days, that public service is an honorable thing, public service in any capacity, and you deserve benefits that you can count on. So we honor your service to the Commonwealth and to your local communities. We are here to serve you. And in fact, we serve alongside you as state employees, the 74 employees here at the GIC. The second thing I would note is in the middle of that second line, high quality and affordable benefits. So embedded there is the notion that we are balancing two really important objectives. We want to provide you with those high quality coverage benefits, as much value as we can squeeze into a plan we want to provide to you. But we also understand that that comes at a cost for you in the form of premiums and copays and deductibles, but also to the taxpayers who contribute a portion of your premium. So we're trying to strike the right balance to create the most value for you and for everybody that pays premium. Next slide. So to achieve these goals, the Commission has identified three core strategies for our success. And I'll start with the box in the middle here, managing for value. So we aim to design and make available to each of you a meaningful choice of insurance options and benefits that provide the most value to you. I keep using that word value, but it's at the center of a lot of what we do. To the left of the box on the left here, we aim to provide you with a set of modern tools so that you can make the decisions that are best to meet your needs when it comes to purchasing insurance. Interacting with the GIC shouldn't be a hassle. It really should be as easy as using any other online tool that we all use to purchase goods and services in this day and age. And then lastly, to the far right, we need to modernize the GIC. In order to do each of those things to the left, we need modern tools ourselves, and we are making a significant headway to modernize our systems here. So these are the kind of three interrelated core strategies that we believe are going to be essential to our success. Next slide. So some additional key salient facts here. GIC has 462,000 total members, of which 110,000 are Medicare retiree subscribers, which makes us the largest purchaser of health insurance in the Commonwealth with an annual budget of over $2.1 billion. We are governed by a 17-member commission. You'll see in the lower left. I'll talk a little bit more about them in a moment. But we also have a really wide variety of state, regional, and local partner agencies, certainly state government, cities and towns, regional school districts, local housing authorities, a wide variety of such agencies. Next slide. So I do want to acknowledge the service of our 17 commissioners. You'll see here that they represent a wide variety of interests and expertise and background. We meet with them about monthly to make all of the key decisions that relate to the benefits that we offer you. These are essentially my 17 bosses, and they're an enormous help to me. So I'm happy to say as well that our commissioners have been participating in these sessions today. We are joined by Bobby Kaplan from the National Association of Government Employees, NAGE, who is my esteemed vice chair, Anna Seneko, who is a public appointed member and tremendously helpful on data analytics to help us understand the behavior, the kind of behavior of our members as consumers, and Melissa Murphy Rodriguez from the town of Andover, representing the Mass Municipal Association, but also a really important voice to represent municipal interests at the GIC. Next slide. So this will look familiar. These are the benefits that the GIC offers. I won't spend a lot of time on this, but includes health, dental, vision, life, long-term disability, We do flexible spending accounts for healthcare and dependent care. And I hope each of you is familiar with the employee assistance program that we offer called Mass for You, which is an excellent resource for a variety of not just health issues, but any sort of challenges in managing modern life that you may have. They're a super resource. Next slide. So I thought it'd be helpful too to just give just a brief image of how the GIC is funded. We're funded from a number of resources, the main ones being the Commonwealth of Massachusetts, if you're a state employee or retiree, and your city and town if you're employed through a municipality. In addition, of course, you, our members, contribute to your premiums through either your paycheck, if you're employed, if you're a retiree, often through your pension check. Combined, these sources comprise the GIC's total budget of $2.1 billion per year. Next slide. So the way GIC benefits are financed is, without getting too much into the weeds here, is a little different from what some of us may be used to in private commercial insurance. The GIC is self-insured, which means that the GIC and ultimately the Commonwealth of Massachusetts and its taxpayers hold our financial risk, not the insurance company that you are enrolled in. So when you receive services from a doctor or a hospital, they submit a bill to the health plan in the form of a claim, which so the health plan then pays that provider for the service. And then those insurance companies, including our pharmacy benefit managers, bill the GIC weekly for those expenses, and we reimburse them. So over the course of a given year, if our members use more services than we've expected and we've based our premiums on that, the Commonwealth of Massachusetts will pay that extra amount, and it protects you, our members, from having to be liable for any additional amount. So the other flip side of that is that if our members use fewer healthcare services than expected, the Commonwealth spends slightly less, but you in turn as our member do not. Your premium rates are stable throughout the course of the year. And actually, if we look back at the last 10 years or so, it's been about evenly split. Some years the Commonwealth covers that entire extra expense, sometimes in excess of $100 million. And sometimes they pay less than predicted. So it's actually, it works out pretty evenly both ways when you look at it over time. Next slide. So the challenges that we at the GIC face in providing you, particularly your health benefits, are not unique to us at the GIC. These are challenges that everyone as residents of the Commonwealth face, those that purchase insurance. I could easily spend an hour going through each item on this slide, but allow me to pull out a few key points. I don't think it's revolutionary to say that healthcare costs are not sustainable, and they continue to grow. That is true for people with private insurance, and it's true for those of us with GIC insurance. After a few years of relative stability in our premiums, we had a few years where it was either no increase or a very modest increase. We are starting to see those costs grow. And again, everyone who purchases insurance these days is starting to see those costs grow. We at the GIC are not unique to that. And so we keep that very front and center in all that we do here. And we're reminded of the fact that for many of you who are state employees or retirees, you've not gotten into this business to get wealthy. And I'm reminded that an average teacher pension from looking around a little bit over the last couple of days is only a little bit more than $40,000 a year, and that's a fixed income. So the rising cost of care, absent strategies by us to address them, will continue to eat away at that and erode that income. So that's very high on our agenda. Secondly, it's hard not to pick up a newspaper these days and not read about some big hospital acquiring a new, smaller hospital. And evidence does show that these sorts of transactions don't tend to lead to decreasing costs. In fact, they tend to drive up costs. That is not always the case, but the evidence does point in that direction. So in Massachusetts, we do continue to see large, well-known brand name hospitals and hospital systems get bigger and gain more and more market power and increase, in turn, their already high prices. Now, the GIC has an opportunity to use our purchasing power to push back on that. But we have historically chosen to sort of divide up that purchasing power among the half dozen or so insurance plans with which we contract. And that ultimately dilutes our ability as a major purchaser, $2.1 billion, 462,000 members, to really get at this underlying challenge, this growing challenge of continued consolidation among hospitals and physicians. So that we need to continue to look at closely. Finally, health insurance coverage seems to get more complex and more confusing every year. I'm in this industry and I still believe that. We go to the doctor for a necessary service. We use our insurance card thinking it's going to be a covered service, only to find out that we get a big bill in the mail from our doctor or hospital, and we don't understand why. So the GIC, in addition, has attempted to craft plan designs that provide incentives through lower cost sharing for our members to choose a lower cost but equally high quality hospital or doctor. But we have tended to see that consumers, our members, are not responding as we would expect to those sorts of financial incentives, and instead will go to the high cost hospital and just incur a $1,500 copay. So we need to learn from some of these things about how to manage the complexity of plans and make sure that they're working as designed and not simply creating friction and frustration for our members. So these are a lot of the challenges that we face. We're trying to strike that right balance of affordability and high quality, which ultimately produces value to you, and we'll continue to struggle with these challenges. With that, I want to turn it over to my colleague Denise Donnelly, who will walk through the next section of the presentation on premiums. Denise?
Thank you, Matt. Yep, thank you. Next slide, please. And you can click all the way through this, Erica. It's a build. So I'd like to walk you through how the GIC goes about developing premiums for the upcoming fiscal year. Back in December, we presented to the Commission, based on analyses by our actuaries, what we call status quo pricing. And that simply means that what would the cost be for fiscal year 22 if there were no plan design changes, if members stayed in the same plans as they're in now, members didn't change their behavior in terms of using care, we didn't make any plan design changes, and the carriers all stayed the same. So we presented that to the Commission back in December, as we do every year. This is the process we follow every year for determining the rates. Then, back on January 21st, we presented to the Commission any proposed plan design changes that we would like to recommend. And as Matt said earlier, we are not recommending any plan design changes that increase member copays. There's really just one plan design change that we'll be sharing in a moment. And we present those plan design changes to the commission, together with any financial impact that may be associated with them. Then, as happens every year in February, we meet with the commission for them to vote on any proposed plan design changes. And this vote allows us, working with our consultant and actuary, to model out what the individual premiums will be for each plan and each coverage level. So that vote is needed before we can then move forward to the March 4th meeting, where we present to the commission the plan and coverage level specific proposed premiums for the commission to vote on for the upcoming fiscal year. Next slide. So let's take this slide slowly. So assuming that there are no plan design changes, what we are looking at for fiscal year 22 for an aggregate average premium increase across all the Medicare and non-Medicare plans the GIC offers is somewhere between 4% and 7%, most likely in the range of about 5.8%. Now, this does not mean that your premium is going to go up 4% or 7% or 5.8%. It means that across all the plans, Medicare and non-Medicare, the average aggregate increase is expected to be 5.8%. And this is in line with what we are seeing in the general market in Massachusetts, with insurance companies estimating 5% at the low end and 7% at the high end as increases for the upcoming year. Next slide. And so once we make our way through that process with the commission, we then are able to launch annual enrollment. And this year, annual enrollment for coverage effective July 1st, 2021 will begin April 7th and run through May 5th. Thanks. Matt?
Thank you, Denise. So now we'll move on to a discussion about plan design that Denise referred to. Next slide, please. So here I'll start where I noted at the beginning. So the GIC staff recommended to our commission at their meeting last week, and the commission agreed that we should make no changes to health insurance coverage or plan design that increased cost sharing to our members. This is generally a principle that we like to follow for changes to plans while we are in the middle of our contracts with our current plans. And we do so understanding that a rolling set of changes every year can be disruptive to members, and referring back to my prior comment about complexity, can be just hard to make your plan hard to use in a way that you understand. And I would say that concern is only further heightened by the fact that we are, of course, in the middle of a pandemic. So the commission, that was our recommendation, and the commission did agree with that. Also, I'll note, as the bottom bullet here notes, we are making no changes to our Medicare supplement plans this year as well. That doesn't mean that the federal government could not make changes to Medicare that affect you, but we at the GIC are not making such changes. Next slide. So here's the list of our current health plans and each of their offerings for this current year. Actually, for the last several years, we are making no changes to this lineup of health plans or products that they offer for the coming year. Next slide. Go back to, there you go, thank you. I did want to note here something that some of you may have questions about. You may have heard or read in the paper that Tufts Health Plan and Harvard Pilgrim Healthcare have recently announced that they have joined into one combined organization. I have been, as executive director, here in touch with the CEOs of both of those companies and expressed our strong interest that there be as little disruption to our members as possible as a result of this merger. And I can tell you that they have each expressed to me that they share that important goal. You may read in the coming months that they announce a new name for the combined company, but I have been assured that they will both continue to operate as separate companies for some time. So if you are currently covered by either of these health plans, there is no immediate change to your policy, and you can continue to be enrolled in that plan and should continue to use your current ID card. Furthermore, for this coming annual enrollment, members will be able to maintain coverage in these plans if you want, or newly enroll in each of these companies or their products that you want. And I would say the same for next year's annual enrollment as well. So for the next 2 years of coverage, it will be, for the most part, from the members' perspective, no changes as a result of this merger. Each of those plans, the combined group of those plans has posted information about the transaction and how it might affect you. And there's a link here that you can access to pull up that information. I would encourage members to continue to watch the GIC website as well. We have some information there on this topic that mirrors more or less what I'm saying here, but we will continue to update that as is necessary. Next slide. So as Denise noted, there's only one minor, relatively minor change to the plans that we recommended to our commission. You will note that it is not an increase in copayments, as I noted, but a decrease in copayments for a particular service. The proposal is to provide 3 behavioral health telehealth visits at no cost to you, so no copay, no deductible. Furthermore, I'll note, for those of you who are aware, the Mass for You program offers a similar benefit, 3 free therapeutic visits per year, and those will continue as well. So this new benefit would be additive to that. We see this as a really important way to maintain access to behavioral health services, which of course is especially important given where we are in the pandemic and its impact on behavioral health, which is substantial, but really to help provide expanded access as well. We know that there are real challenges in the behavioral health system to get access to needed services. So this feels like a really important, though modest, step that we would take in this direction. One of the things that we know is that changes to copays and deductibles are very blunt instruments, and they don't tend to produce meaningful reductions in premium compared to the friction that they introduce for our members. However, as I noted earlier, the rising cost of healthcare in the state, which we see reflected in rising premium, certainly is a challenge that we need to confront head on if we're going to provide affordability to you. So while we are standing pat here this year for a lot of important reasons, we will need to take steps going forward to address that issue. On that note, I'll turn it back to Denise to talk a little bit about the process that we'll be using really to get at most effectively these underlying challenges, particularly related to cost, and that is the procurement process. Denise?
Thank you, Matt. Next slide, please. So in this section, we'll take you through the process that the GIC follows to go about procuring coverage for our members. Before I begin, though, we thought it would be a good idea to talk about what procurement is. Procurement is the process the Commonwealth typically uses to contract with private companies to perform state-related work. And this is a process that's very strictly governed by mass law with an emphasis on ethics and transparency. It's the process we use in compliance with that law to select health insurance plans and other types of insurance companies to provide coverage, usually for a period of 3 to 5 years. Most of the contracts are 3 years with 2 one-year options to renew. So with that understanding of procurement, we'll move on to the next page. So right now we're in year 3 of a 5-year contract cycle, which means we are very busy preparing for this next procurement process. And what's going to happen between now and whatever the new coverage is that takes effect on July 1st, 2023, and you should all know that no decisions have been made, and nor will we be in a position to make any decisions until we actually complete the procurement process. So between now and that date, the GIC is conducting listening sessions such as this one, looking for other opportunities to listen and learn from our members, engage with our stakeholders, and really understand the considerations that we should take into account as we proceed with this procurement. We'll then begin the actual procurement process, and that will lead us to the point where we'll have new coverage that will take effect on July 1st, 2023. And as you do every year, you will have the opportunity in early 2023 to decide which plan you want to enroll in. So we'll conduct an annual enrollment, and that new coverage will take effect on July 1st, 2023. Next slide. And as Matt said, we're using this opportunity to really try to get at some of these enormous challenges that confront the GIC and other purchasers in the marketplace to try to deliver to our members the best value that we can for the dollars that you spend and the Commonwealth spends. So that will be the purpose of the procurement. Next slide. What are the principles guiding this procurement? Well, first of all, the procurement is anchored in our mission, which Matt touched on at the very beginning of the presentation. But in addition to that, we're really looking to give members easy to understand, meaningful, and affordable choices. And by affordable, I mean affordable in the context of the Massachusetts marketplace. We want to simplify the experience of choosing a health plan and using coverage for our members. And we want to bring all of you along on this journey so that by the time we get to whatever it is we decide for July 1st, 2023, people understand that it's the best possible solution that we could come to given the challenges that we're facing and given our principles here, our guiding principles. Next slide. And Matt, with that, I'll turn it over to you.
Thank you, Denise. So as Denise noted, key to our success in this coming procurement is to engage with as many voices and entities that we can who have an interest in what we do. We need to start by listening to and learning from a variety of sources. And of course, we start with you, our members. That's why we're here today, and that's why it's so important for you to participate. There will be more opportunities that we will roll out for you to do so in the months and years ahead. We also will be learning from our colleagues in state government and the legislature, in the executive branch, as well as our partners in local government. And many of you are represented by labor unions who represent your issues to us and to others. I can tell you that we are in regular communication with labor leaders and will continue to do so. They are an important partner for us. The more we learn, the more we understand, the better decisions that we're going to make through the coming procurement. So thank you again for joining us here today. So there's, I think, just one more slide, informational, before we move to the Q&A. So as I've noted earlier in the deck here, I would encourage each of you to access the GIC's website for information on a variety of important topics, some of which I've covered here today, some of which we don't have time for here, but important information nonetheless. As I noted, all of the information that we're presenting here will be posted there. Next slide. So here we complete the formal presentation. We will proceed with questions and answers. As was noted, we've had staff monitoring the Q&A stream here, and we've also received a number of questions in advance of this session. We're going to do our best to cover as much ground as we can here, particularly focusing on those questions that kind of represent themes that would be most relevant to a large portion of our audience. Again, I would suggest if you have specific issues that we may not address here, to submit that information directly to us through the link that you'll note at the bottom of the slide, or to give us a call. We've got a very dedicated team of folks in our operations unit who are here to help you and to walk you through specific challenges that you may be facing as it relates to your benefits. So with that, I will look to my colleagues to start the Q&A section, and we can proceed with that. Thanks very much.
Thanks, Matt. So, hi, this is Erica. I will be starting off with a series of questions here. The first question is, currently, if a survivor predeceases their disabled adult dependent, the disabled dependent loses coverage. Can this outcome be reviewed?
I would refer that one to Paul Murphy, my colleague in our operations unit.
Thanks, Matt. What I would like to let everyone know is GIC just did a review of our rules and regulations, and we have looked at that issue because we have received inquiries on that particular issue over the last couple of years. And I'm happy to say that we are offering coverage to surviving handicapped dependents beyond age 26 should the surviving spouse predecease the member. And we'll be sending more information about that out during this year's annual enrollment so that we can make that benefit available for July 1.
Thank you, Paul. I do see in our chat function here there are a number of questions. So I just remind folks, if you have a question to ask, please use the Q&A function, and we'll assemble those. Erica?
Thanks for that reminder, Matt. So we've had some questions coming in, just a general theme about GIC budget performance and rate increases. How do these two things relate to each other? And this could either be for you or for Jim.
Can you repeat the question, Erica? Sorry.
Sure thing. We've had a couple of questions, more than a couple of questions come in about GIC budget performance and our rate increases, and how do these two things relate to one another?
Yeah, it's a great question. So we establish rates as the timeline that Denise noted earlier in the slide presentation, well in advance of their effective date. So we have actuaries that do their best to try to predict what the utilization of healthcare services would look like so that we can set premiums at an appropriate level. There do occasionally happen some instances where those projections are off. I would say this past year has been a very extraordinary year in that respect. However, what we're talking about here is the coming fiscal year. So this is for coverage, as has been noted, that starts on July 1st. So our actuaries have done their best to model all of the various impacts on healthcare utilization in that year. It's been extremely difficult to try to account for the impacts of things like COVID. I will say that the fact that we are seeing an increase going forward is indicative of the fact that there is projected to be a substantial return of utilization to services as we get ahead of the pandemic, as the vaccine continues to roll out, and we can, as the governor said last night, start to put the pandemic behind us. There are also pretty substantial an expectation of a large chunk of services that have been deferred during the pandemic that are likely to be return in the coming year. I will say that, as Denise noted, that our projections for the year ahead are consistent with, and in fact, a little bit below what we are seeing in the private insurance marketplace in Massachusetts. And it's a trend that we're seeing nationally. So we are not immune to all of those challenges, and we're doing our best to make sure that our premiums are adequate and as fair as we can make them. Jim, I don't know if there's anything there you want to add to.
Hi, everyone. Thanks, Matt. I will just add, I saw a few questions on our actual spending and performance to budget, and I don't want to spend a lot of time on that here because we do report on it at the commission, at every commission meeting, and those slides are posted on our website. And also, of course, our annual report is on the website. You can see spending there. So if there's any questions about our specific performance to budget, you can see those in those places and on the Commonwealth website, since we're a component part of the Commonwealth. Just wanted to add that if people really wanted to get into the weeds of it, the information is available.
Yeah, one of the things I will note from the recent slide deck that you're referring to, Jim, those slides about our financial performance, is we've seen in excess of $100 million of impact on services that are directly to be attributed to COVID. And those expenses, as you can imagine, sort of track the impact of the pandemic, where in the spring we saw, we know that many people ended up in the hospital for acute treatment, ICU treatment, on ventilation. We saw that reflected in our claims in the spring. We did see that tail off through the summer and early fall months. And then with the second surge of the vaccine, we've seen again those COVID claims spike back up to even higher than they were in the spring. So we watch all of these things very, very closely, and we'll continue to do so.
Right, and if I can add one more quick thing, in terms of this year connecting to next year, we've seen lower utilization, so that's obviously made us favorable to budget. But costs continue to go up, the unit costs do, and I think Matt and Denise made this point, but when we look at next year's budget and premiums going up, that healthcare inflation is still very much part of the equation, and we're projecting next year's budget needs. And I think you said that, but I just want to make that point again, if you don't mind.
Thanks, Jim. Erica?
Thank you. So the next question we have, if I was married last year, can I cancel my individual health insurance and be added onto my spouse's family health insurance during open enrollment in 2021?
I think I know the answer to that, but I'll defer that one to Paul Murphy in our operations unit.
The simple answer is yes. During open enrollment, is the time where you can add any spouse or dependent, and you can also remove any spouse or dependent from your health plan. So open enrollment, the answer is yes.
And I would say, Paul, is getting married is also a qualifying event per federal rules. So an individual wouldn't necessarily need to wait till annual enrollment to be added to GIC coverage. Is that true?
Correct. What annual enrollment does is members are allowed to switch health plans, add members, take members off their plan, change coverage from family to individual, individual to family. It happens once a year, April and May, for coverage effective July 1st. However, after annual enrollment, we know that there are changes in one's life that, marriage, birth, divorce, death, and those are what we refer to as qualifying events. Qualifying events allow members to make changes to their insurance coverage throughout the year off the annual enrollment cycle. Keep in mind, though, that many of these qualifying events have a 60-day window in which you must inform GIC to make that change. So if you have any questions regarding qualifying events, I would refer you to our website at mass.gov/GIC, and you can type in qualifying events in the search field, and you will see the actual chart of all the events, deadlines, and forms needed, and documents to be sent in throughout the year.
Thank you, Paul.
Thank you. So the next question is, how can we determine which doctors and hospitals are in our plan?
That's a good question, and I would direct members to their health plan's website. They are required by state and federal law to have a complete listing, often in a searchable form, on their website of all providers with whom they have a network contract. There has been significant progress, I'd say, even just over the last year or 18 months to improve those websites so that they are more user-friendly and helpful. That is especially the case in the area of behavioral health, where they are now required to include substantially more information about which particular behavioral health conditions they treat or have particular training in. So I would direct you to the carrier's website for that provider directory.
Thanks, Matt. The next question is, which new vendors will we see after the new procurement?
So the short answer is we don't know. We will, through the procurement process, what we essentially do is to put out the requirements and what we want in coverage through that procurement, right? And we offer that as an opportunity for insurance companies to bid. If they want to participate in the GIC, they can submit a proposal to do so that we will review with an expert team here to make sure that it meets our criteria. But we also can't force them to do that. We can encourage them to do that, whether they're carriers that are based here or national carriers. So the short answer is we don't know yet, but we hope to see a robust response from carriers.
Thanks, Matt. Another question is, I understand Benefit Strategies was to have posted extension of time to use fiscal year 2020 for HCSA monies that would have been lost if not spent by January 1st. Is this the case, or was the time extended to June 30th, 2021? And I think this is a question for Cameron.
Yep.
Sorry, I've been trying to respond to some of the questions coming in through the Q&A. Yes, as part of the Consolidated Appropriations Act that was passed in the first week of January, we were offered the opportunity to extend additional relief to members with unused FSA funds, both the dependent care and healthcare FSA accounts. We have extended the grace period for fiscal year 20 through the end of the current fiscal year. So if you still had money that was left unspent, initially as part of the CARES Act, we were able to extend the grace period through the end of December 2020. Now you have the entire length of this plan year. Also, as part of the same act, we are able to allow people to make prospective changes to their current year elections at any point during this plan year. So you could go in and increase or decrease your election amounts on a going forward basis at any time without a qualifying event. Now, that does not entitle anyone to a refund of amounts that have already been withheld, but those are the major changes that we were able to implement as a result of the Consolidated Appropriations Act. All right,
Thanks, Tony.
and it looks like there was another question about the vision plan. Now, without additional information, it's hard to directly address this because the dental and vision plan offered for active employees by the GIC is only effective for executive branch employees who are not union members. So, if you are a member of a union who gets your dental and vision benefits through collective bargaining, or a member of a municipality, we would unfortunately not be the people to address that. But we do have Davis Vision that is a bundled product with our active dental coverage available to MetLife, those non-union executive branch employees. And Davis Vision also has a retiree discount plan that is automatically bundled into GIC retirees who have medical coverage with us. So without knowing more specifics about that question, I don't know that I can answer them. Erica, have there been any other questions that have come in?
Yes,
that I
there
can
are
help
several. There are several, so I'll just get to them in order.
Okay.
So the next question is, have you looked at the option of having an employee plus one plan to allow for a lower premium compared to the cost of a family plan? And Matt, I think either you or Denise for this one.
I'll defer that one to Denise.
There, yes. We've actually looked at that numerous times. And the challenge that we have is that if we were to offer an employee plus one coverage level option, that would mean that the cost for family coverage would skyrocket. So it's in the very nature of insurance coverage that we spread the risk across a large group. And so it's a trade-off. And while we will look at this again for the procurement process, it's one of those tightropes that we have to walk to try to decide how best to allocate dollars and make coverage affordable for everyone.
Thanks, Denise. So the next question, why do our premiums seem so high given that we have over 460,000 members?
Yeah, that's a great question, and one that we struggle with. I'd say there are, of course, it's a complex question, and I'll do my best to highlight a few of the important facts that we know. First of all, I think as Denise alluded to earlier, we live in one of the most expensive states for healthcare in the country. In fact, one of the most expensive healthcare marketplaces in the entire world. So we, like everyone else who uses healthcare in Massachusetts, have premiums, therefore, that have to reflect that underlying cost of care. Second, we do note that, and we know this from our data, that GIC members tend to use the more expensive hospitals in Massachusetts more than their counterparts in the private insurance market. So that is another reason that it's more expensive. I'd say thirdly is that, and I alluded to this earlier, that we've chosen for a variety of reasons to sort of dilute our purchasing power. Instead of being able to purchase and negotiate with hospitals, particularly the higher priced ones, as a block of 462,000 members, we instead have 6 health plans and members divided up into 11 different health insurance products, and they each of them have a lot less bargaining power than we would have as one unified purchaser. So that dynamic is very fundamental to us getting hold of the cost issue, and the reason why we have less power than we might otherwise have as it relates to these hospitals. There are different ways that we can tackle that problem, and that is one of the central things that we'll have to come up with and think creatively about in the coming months and years. And I'd say lastly that we do have insurance through the GIC that is richer coverage than is typical in the private insurance market, and even when you compare it to agencies like the GIC in other states. And when I say richer coverage, I mean more services are covered by the premium as opposed to copays and deductibles as it compares with others. Now, it may not feel that way. I know copays and deductibles, I pay them myself. They are not insubstantial. So herein, again, lies the real challenge for us to try to strike the right balance there and provide you a premium that you can afford. It's a big challenge that we're going to have to tackle.
Thanks, Matt. So the next question is, as a person with a generally good bill of health, how can I get the most of my insurance plan? I haven't noticed any health center, gym, massage, therapy, acupuncture benefits, etc., that I can use for preventative health practices. Do you have any information on this?
Well, I think that will vary to some degree by the different insurance plans. I will note that, there are fitness reimbursement programs that each of the carriers have. I'm familiar with some carriers that do offer coverage for acupuncture. I think that has been an area of some progress here, whereas 5 years ago, it was generally not covered by the plans. We do also, we will be looking at this suite of programs that can benefit you just outside of your covered insurance benefits. We always review that. We will continue to do so, certainly through the next procurement. I may see if, yeah, Denise?
Yeah, I just wanted to add, Matt, and of course, as required by law, preventive care is covered at 100% under all of the plans. So please be sure to get all of your screenings and exams done. And that's, I think, one of the best ways you can make full use of your plan.
Thanks for that, Denise.
Thank you. So the next question we've got, are there options for retirees who are not eligible for Medicare? Does the GIC have a Medicare buy-in program?
I think I would defer that one to Paul Murphy. Or
Currently,
Denise. Yeah, go
I
ahead.
think Denise may want to take
Yeah.
the buy-in to the Medicare.
Sure. So we understand that some municipalities in Massachusetts have worked with Blue Cross Blue Shield of Massachusetts to buy into Medicare. We are examining this, but it's a massive undertaking for an entity like the GIC. Unlike these small municipalities who have maybe 20 or 50 retirees who fall into that category, we have between 6,000 and 8,000 retirees who fall into that category. So right now, your only option is Unicare Basic, but we are looking at other options, although I have to say it's a very complex and expensive process for the GIC. So stay tuned on that.
Yeah, I will note that this is an issue that Mass Retirees has been very good about putting before us and continuing to engage with us on. So we will continue to work with them on that.
Great. So the next question I have, are COVID-19 vaccinations being covered by the GIC?
The answer is yes. The vaccine itself, the actual shot, is covered in full by the federal government, and the cost of administering the shot, which is a bill generally generated by the insurance company, is also being covered in full by the GIC. I will note that if you go to your, this is something to be aware of. If you go to your physician for an office visit, not necessarily for the vaccination itself, and it is an office visit that is not preventative in nature, so therefore would not have a copay, just be careful to make sure that you understand what your cost-sharing liability would be in that instance. It may be that you get a copay for the office visit, but you should never get a separate copay or anything like that for the vaccine itself.
Thanks, Matt. So another question, if I'm satisfied with my current insurance plan, do I need to participate in the open enrollment, or rather annual enrollment?
The answer to that is no. We do have the option for folks to continue on their current coverage by not taking an active step to engage during the annual enrollment period. I will say that I encourage everyone to do so, particularly as we go into a period where we will see increases in the plans. As Denise has noted, the numbers that we described earlier in this presentation, about 5.8% overall aggregate increase in premiums, that is an average. So some plans will be increasing premium by more than that, others by less than that. So it may well be that that the premium for you to renew in the plan that you're in now is going up, and you can benefit by shopping around a little bit. So I do strongly encourage everyone, actually every year, to closely evaluate your current coverage, how it's changing, and where you might be better served by making a change. It's a good question.
Thanks, Matt. So we've actually had quite a few questions regarding retirement. So there are a few that kind of jump up to the top here. The first is, due to COVID, should I apply for Medicare earlier? This person will turn 65 early this year. So let's start with that one as far as retirement goes. And I know we have a few more. So Paul, if that was something you wanted to touch on.
Sure. As far as that question go, I wanted to let everyone know that when you reach age 65 and you are retired, GIC does reach out to all our retirees and their spouses to ask about their Medicare eligibility. So we start the process 90 days before someone turns age 65. During that time, we encourage people to call Social Security or visit their website at medicare.gov to apply for their Medicare benefits. Social Security has encouraged many of our members to go online and apply for your Medicare directly online to save some time due to some of the delays with COVID. So we understand that when we are asking questions regarding Medicare, and we also give somebody 4 months to apply for the Medicare coverage during that time. And that's the reason we start the process 3 months before turning 65. So as soon as you can have that conversation or go online with Medicare, we encourage people to do that upwards of 3 months before they turn age 65, so that they have their Medicare coverage in place upon age 65.
Thank you, Paul. So another question related to retirees. Does the current coverage for retirees also stay the same if we make no changes in annual enrollment?
Is that another question for Paul?
Could you repeat that one, Erica, please?
Sure thing. Does the current coverage for retirees also stay the same if we make no changes in annual enrollment?
Okay, thank you. Yes, the coverage remains the same. You continue in the same plan from one plan year to the other. My rule has always been, if you do nothing, nothing happens.
Thank you. So another question related to retirement. What are the requirements to sign up for Medicare if they're not planning on retiring at 65?
What I probably should do is, what I'd like to do is give a high level talk about retirement. I seem to think there's a lot of questions coming in: retirement, Medicare, life insurance, and dental. So I'd like to take a couple of minutes to talk about high level, what you need to know upon retirement. All of the topics that I'll be referring to are available on our website. We have a frequently asked questions section regarding retirement. We have a turning age 65 video on our website for retirement. We also have benefit decision guides on our website for retirees, both in the Medicare and non-Medicare plan. Those books will be updated by the end of March, beginning of April, in time for this year's annual enrollment period that starts on April 7th. So please keep that in mind, that the new books will be going up on our website immediately prior to the start of annual enrollment. In those books, we will list any information that a retiree or member needs to know, as well as all of the new plan.
Paul, we lost you to mute.
If we can't get him back, maybe we can come back to that question.
Sure thing. I do have a question, actually, Matt, for you in the meantime, while we get Paul back.
Okay.
Going back to your earlier slides, if the GIC is really self-insured, are the outside companies we use a go-between?
In some respects, they are. And so we rely on the carriers to perform a variety of functions, not least of which is to interact with you, our members, to make sure that you can navigate your insurance plans effectively. As we noted earlier, they are the source of information about all providers that you can access in your plan. They also, we rely on them to negotiate favorable prices for services on our behalf and on your behalf. But ultimately, the insurance risk is held by the Commonwealth of Massachusetts, not even necessarily the GIC, but it is the state budget ultimately that holds the risk. So that is correct. That comment is correct. I would say, a go-between, I think perhaps might under-describe what they do for us. We rely on them for a wide variety of services, but that core insurance function is provided by the Commonwealth.
Thanks, Matt. And I think we have Paul back. There's some technical issues with Paul's computer just automatically muting him. So bear with us. But Paul, if you wanted to get back to what you were saying.
Sure. Thank you, Erica. I apologize. The computer seems to have a mind of its own today. But getting back to the topic on retirement, I left off where we encourage members to have a conversation with their HR department before they leave so that the necessary forms for GIC are completed to ensure coverage once you leave employment. The criteria for someone to get GIC benefits upon retirement is that the person must be eligible to collect and receive a monthly pension from either the State Board of Retirement or a local pension authority. That is the criteria that must be met in order for you to continue benefits as a retiree. One area that we get a lot of questions on is what happens once I leave employment and when my pension check kicks in. During that interim, once you leave and when your pension is approved, we will bill you at home directly for all of your GIC coverage. And that bill will continue until such time you collect your first pension. Once you collect your first pension, GIC will take the premiums from your pension check. Medicare. What happens with Medicare, we get a lot of questions. And again, individual eligibility for Medicare must be made with Medicare.gov and Social Security. GIC does not determine any eligibility for Medicare. However, if a member is age 65 or older, or their spouse is age 65 or older, upon retirement, they are required to join a Medicare supplemental plan with GIC. So once GIC receives your paperwork, GIC will reach out to both you and or your spouse with a letter with instructions telling you what you need to do to enroll in Medicare, and we will also give you information on all the Medicare plans that we offer. So we send that directly to the member's home, both the insured and the member's spouse. If somebody is under age 65 when they retire, GIC will continue keeping you in the non-Medicare plan until such time either you and or your spouse reach age 65. Upon age 65, we will notify both you and your spouse the options to enroll in a Medicare supplemental plan. So if you're under 65 and age into Medicare, we will notify you. If you're 65 or older upon retirement, we will also notify you by letter with your options for Medicare. If you are continuing to work after age 65 for the Commonwealth or any employer, but you have GIC benefits, there is no need to enroll in Medicare until such time you decide to retire. So again, we get a lot of questions regarding Medicare if I continue working after age 65. There is no need to enroll in Medicare if you continue working after age 65 and you have GIC benefits. Life insurance. We encourage people to look at the life insurance upon retirement. Those that have optional life, we call it, or supplemental life, that coverage can be very expensive upon retirement. And that will continue to increase as a retiree gets older, age 70, 75, 80, the premium increases. You have the option to either decrease, cancel that coverage upon retirement, or GIC will also contact all retirees 2 months before they are going into a new category and a higher premium to give the option to either reduce or cancel their coverage at that time. So we do send out letters before the premium increases to warn the retiree if they'd like to cancel or decrease the coverage. Dental. There's a lot of confusion out there about the dental plans that are out there. GIC offers a retiree dental plan to all of our members upon retirement. So that is one option that is available to all retirees upon retirement. If the retiree does not choose to enroll in the retiree dental plan at retirement, you as a retiree can do so during any annual enrollment period following your retirement. So you do not have to enroll at retirement. You have the option to enroll, but if you defer it, you can enroll during any time after you retire during the annual enrollment period. We encourage people to look at their current dental plan and the options to continue up once they leave employment. Many employees get dental through their union or through an employer, and there are options to continue those benefits. And sometimes those plans can be a better plan and continue that coverage for a period of up to 18 months through COBRA with their employer or union. But you also have the choice to join GIC's retiree dental plan upon retirement. So there's a little bit of homework you need to do as a retiree. You do have some choices, but I encourage people to look at both of those choices and speak to your employer about, or your union about, continuing coverage upon retirement so that you have the best information to select the plan you need to do. If you want to continue with your dental plan through a union and COBRA, by all means, you can do that. If that coverage ends, you then can hop on GIC's retiree dental plan. Or you can ignore the COBRA coverage with your union or employer and hop right on GIC's retiree dental plan once you retire. I think that was a very high level, quick retirement seminar. I apologize for taking.
Looks like the mute function kicked in. Sorry about that, Paul. So we have a couple of other questions, and I know we just have a few minutes left here. Let's see. If I would like to increase the amount of money I put in my FSA account, when can I do that?
Hi, this is Cameron again. If you are currently participating in the FSA plans for the current year, you can make a change on a going forward prospective basis at any time. You can reach out to your GIC coordinator for assistance or go directly to the Benefit Strategies website.
Okay, so the next question is, it's fairly confusing as to what services, procedures go toward deductibles / max out of pocket versus what is actually paid by insurance and what the member is responsible for paying. Is there any way to make this more clear for members?
Yeah, that's a good observation, and I'm sure others have had that experience as well. So I guess I would suggest two things, well, three things. One is we will consider what we can do to be more helpful and provide more clear, usable information for you. That is information that the insurance companies would make available to you. The evidence of coverage, which is kind of the core insurance document that lays out all the details of your coverage, would have that kind of information in it. It is a big document, but they do typically include a table that shows which specific services are covered in full or covered with a copay or covered with a deductible. They can be a little daunting as documents. I will say that it's federal regulations that really prescribe what those documents look like. So I don't think any of the plans or we would want them to be so complicated and hard to navigate, but that is, it's sort of a reality. I think the second thing I would suggest, so we'll take a look at it. Number two, consult your evidence of coverage for your plan, which is a document you can get from your insurance plan, but also just be in touch with member services at your health plan. They can refer you to the document, they can walk you through it, or they can just give you the answers that you may have questions about.
Great, thank you. Let's see. Another question here from an individual, and the question reads, now that deductibles are triggered at virtually every encounter with the medical system, what is the role of copays? What does the research say about the interaction of deductibles and copays on consumer behavior?
The interaction of copays and deductibles?
What is the, so now that deductibles are triggered at virtually every encounter with the medical system, what is the role of copays? What does the research say about the interaction of deductibles and copays on consumer behavior? And this individual noted that they heard us say earlier that copays haven't really resulted in changed consumer behavior.
Yeah, it's a great question. I can't say that I have a really comprehensive answer to that. I will say that the question illustrates one of the challenges that we have, and I'll be a little bit repetitive to what I said in the presentation, so forgive me, but copays and deductibles, I think, are generally understood and designed to provide an incentive for a consumer when they seek care to choose a lower cost setting for care. I think the evidence tends to be mixed at best about how effectively they do that. So we actually have, as a member of our commission, I think one of the commissioners who's joined us today, who's done, Anna Seneko, who's done a lot of research on this topic. We are in regular touch with her staff about data analysis they've done about our members, and then just generally about consumer behavior and cost sharing. So while I don't have a more comprehensive answer than that, I will tell you that the challenge that's embedded in that question is one that we are very keen to understand in more detail as we go into the next procurement.
Thank you. And I'm seeing quite a few questions still about the benefit decision guides. So Paul, if you could just touch again on when and where those will be available, I think that would be helpful just as a reminder.
Sure. This year's benefit decision guides are on our website on the homepage. If you look, you can select benefit decision guide. That is for the current year, that from July 1st, 20 through June 30th, 2021. We will be publishing new benefit decision guides at the end of March, beginning of April for this year's annual enrollment. And those guides will be for the plan year starting 7/1/21 through June 30th, 2022. So the new guides and the new rates will be available immediately prior to the start of annual enrollment on our website.
Sorry, I was muted that time. I did have one more question regarding retirement, specific to the FSA accounts, flexible spending accounts. And of course, it just moved on me. If I retire before FSA has been fulfilled, will the payments come out of my retirement check?
Paul may be trying to speak, I don't know.
I think that
Okay.
Cameron may want to chime in as far as what the benefit is
Oh, yeah,
once you
sorry.
leave employment.
Sorry, what was the question? I was busy trying to answer submissions online.
Sure. So if the FSA hasn't been fulfilled by the time an individual retires, will that come out of their retirement check?
Once your employment ends, you have the option to continue contributions if you elect COBRA continuation for an FSA. However, those are not, they don't reduce your tax liability. So there's not really much point in continuing to make contributions after you're no longer receiving pay from the plan sponsor, meaning your employer. That being said, you still have time afterwards to access and utilize your funds. I believe it's a 60-day window in most cases after the end of employment, but this is another area where we are offering flexibility during the current fiscal year as a result of the recent actions by Congress.
Thanks, Cameron. And we have one more question. This may be best for Paul or Andrew, depending on your thoughts, Matt. I'm the budget officer for my town and we participate in the GIC. We are trying to find a way to encourage our employees to choose less expensive plans during open enrollment. Not only would this save the employees money, but it would also impact the town's budget. Many years ago, the GIC offered to cover premiums for members switching to the basic plans. Was that program helpful in driving members to lower cost plans?
Yeah, that was before my time at the GIC. I think either Andrew or Denise or someone may be able to respond to that.
Yes, I can give a quick response. It was temporarily helpful. So as soon as the subsidy went away, people migrated for the most part away from those plans. So it was just a temporary measure and did not have a long-term impact.
Thank you. And seeing that we have a couple more minutes, one more question. With all of the skipped doctor's appointments and skipped surgeries this past year based on COVID-19, will there be an effect on premiums?
Not an effect this year. Premiums are set, as folks know, in the prior spring. So premiums for this year were established then. For the coming year, again, we are developing those premiums based on what we expect to be the utilization of healthcare services in the coming year. So any impact of COVID-19 to depress services is considered as part of rate development for next year. I will note that there are lots of different dynamics that represent the impact of COVID-19 on healthcare costs. The person asking this question notes one, which is that services have been down. We watch the volume of services very closely as we receive claims for services, and there was initially, as COVID hit and the broad shutdowns, even in the healthcare system, did have a substantial effect to decrease the amount of services used, but we did actually see a rebound of those services pretty quickly. We are probably not yet to the level of services that we saw pre-COVID, but we're actually getting pretty close. So what's before us now is to set premiums for the coming year, and we are taking all of those different impacts into account as we do that.
Great. Thanks, Matt. So I think we're just at time now. And we will be putting together, as you mentioned, an FAQ document and a report if we didn't get to your question today.
So let me just close by, again, thanking you all for participating in this session. It's the first time that we've done a session like this in virtual form. I've had quite a bit of interaction directly with members trying to respond to a number of questions. I know a number of our colleagues have as well. Hopefully we got to your question. We are tracking all of these questions and we'll take them back. As I noted, we will address as many of them as we can in our report out. I would encourage you that if you do not see an answer to your specific question, you can be in touch with us through the member contact form that you see on this slide. This is the first of several opportunities that we look forward to making available to you to engage with us. I was looking back through the questions we got in the earlier session yesterday and today, just some really fantastic questions and comments, all of which are very helpful to us as we go forward. So thank you for taking the time. Please stay engaged with us. Follow along in our commission meetings if you like. They're all streamed. We do them on Zoom. We live stream them and archive them on YouTube as well. So those are all available as references for you as well. So thank you again for taking the time. Thanks to my team for presenting with me. And we look forward to being in touch. Have a great day and stay safe and healthy, please.